Welcome to the Preceptor video training. I'm Bobby Martin. The purpose of this video training is to provide you with a brief overview of how to use Nurse Development Resources, or NDR, to assess, evaluate, and validate anyone assigned to you as a preceptor. For the purpose of this training, we will be referring to your preceptee or orientee as a transitioning nurse. This is because we're not only talking about new graduate nurses. Transitioning nurses include experienced nurses new to your hospital or your facility, and nurses moving from one clinical area to another. Whether you orient a new graduate or experienced nurse, you likely use a competency evaluation packet to manage that orientation time. Your facility may require documentation of various organizational or hospital or unit-based competencies within these packets. But we are going to introduce you to benchmarks, which provide you a very specific roadmap to determine if your transitioning nurse is ready to practice independently without your supervision. But these are very different from competencies you're accustomed to. Although similar in look, benchmarks and competencies are different. Benchmarks provide foundational concepts to assess and evaluate when a transitioning nurse is ready to practice independently without a preceptor. They are used to provide a concise but concrete roadmap for you and the transitioning nurse. Competencies, on the other hand, are expected criteria a nurse should be able to perform, such as knowledge, skills, or attributes such as using a glucometer or managing a patient with a chest tube. Both benchmarks and competencies are designed to assist and demonstrate transfer of knowledge to the clinical area, but each uses a different method for validation. Benchmarks, you will be using direct visualization, and competencies, you'll be able to use a number of methods. For example, benchmarks are designed to be a primary determinant for independent practice because of its focus on foundational concepts necessary to independently manage a full patient assignment. In addition, they must be validated by a preceptor after they are demonstrated in the clinical area. In contrast, competencies are expected performance criteria that is specific to a role in clinical practice. A variety of validation methods are appropriate. Examples include return demonstrations, skills lab, and evidence of daily work. So how do you know that your nurse is safe? The nurse you're precepting is safe, your transitioning nurse. How do you know that the nurse is competent and ready to practice independently? What measurement tools do you use currently? Competency evaluation packets, skills checkoff lists. Those are very helpful in evaluating certain clinical skills. But how do you know the transitioning nurse can manage a full patient assignment without you as their backup? Preceptors tend to manage several activities such as admissions, entering orders, or discharging patients, while the transitioning nurse is trying to manage a full patient assignment just to be helpful. When in reality, the transition nurse doesn't get to experience what it's like to actually manage that full patient assignment without help. And it's really important that the preceptor provide that observation, that coaching, and provide supervision until that transitioning nurse can do that independently without that assistance. So you've often had to determine the competence of a transitioning nurse based on your sense of readiness. And with NDR, you are provided with a roadmap and easy-to-navigate tools and resources that include meaningful and relevant learning experiences, as well as standard vocabulary to maintain this transparency and communication between your team members. That's your nurse managers, directors, educators in your education department, preceptors that you may be sharing a transitioning nurse with so that you can provide handoff, and as well as communicating very clearly and effectively with your transitioning nurse. An important underpinning for operationalizing the benchmarks is the married state preceptor model. This model outlines that the preceptor and the transition nurse manage the entire patient assignment together as partners. This gives the dyad the opportunity to have dialogue, problem solve together, and ask questions. The preceptor is able to role model many of the challenges nurses in transition encounter, such as time management, prioritization, and delegation. As the immersion period evolves, and that is the time that you are spent actually precepting a transition nurse, as that evolves, the transition nurse becomes the lead and manages the full patient assignment, with the preceptor acting as a resource and evaluator who serves as a safety net for safe practice. We all know that we make a plan for the day, but inevitably that plan changes. This is part of the dynamic healthcare world we live in and work in, but this demands that the nurse adapt quickly and appropriately. Most agree precepting is an additional role and responsibility on top of caring for a full patient assignment. Unlike traditional precepting models, which have preceptors and transitioning nurses divide and conquer, the married state preceptor model requires the transition nurse and the preceptor to remain joined at the hip. And what this means is you don't cover each other for lunches, you don't take breaks and cover each other for breaks. It means that you really work together side by side and care for your entire patient assignment together. This is to ensure the transition nurse is always practicing safely and allows you as the preceptor to validate their competence through direct observation. But it also ensures the transition nurse can develop essential critical thinking and clinical reasoning. Now, I know what many of you are thinking, that if you have a patient who's going bad and needs to be transferred to another unit, and you need your transitioning nurse to go get you some equipment or go make a phone call or go get you some help, that you will do that. But what you're doing by sending that transitioning nurse to do something during this crisis is you're eliminating the opportunity for them to watch you critically think and make clinical judgments in real time. And that is the best learning moment for these transitioning nurses. When you divide and conquer assignments and divide the roles and responsibilities throughout the day, it really eliminates that opportunity for them to observe how you critically think through problems and how you clinically reason through prioritization. So it's really critical for you to consider this married state preceptor model and see how you will eventually be allowing your transition nurse to lead and manage the full patient assignment, and you can provide that coaching and that support and that backup for them and watch them completely manage a full patient assignment independently, so that once you're ready to validate that they are ready to go into productive staffing and work on their own, you'll feel confident that they can do that.
Here is a video illustration of a preceptor having to cover for another preceptor without the use of benchmarks, which is your consistent roadmap of how to plan, collaborate, and evaluate your transition nurse.
Hey Joanna, how are you?
Yeah.
Okay. This is Maria. She was supposed to train with Renee today, but she called off, so I'm going to have her work with you. I know you do have a busy assignment, but I'm pretty sure the two of you will be able to get this done together. But if you don't, let me know and give me a call, okay?
Thanks.
You're welcome. Bye. Thanks.
Hi, I'm Maria. Hi. Yeah, I'm Joanna. So, listen, I didn't know you were going to be here with me today. So, what do you want to focus on?
Well, last week I had Renee. She kind of told me to follow her around, and, you know, we kind of learned as we went.
Okay. All right. Well, why don't you just follow me?
Okay.
All right. You know, if you have any questions, ask me.
Okay. This is only my second day, so.
Yeah. Well, just follow me, and then you can pick back up when Renee comes.
When Renee comes back? Okay.
Yeah. But
Okay.
we have a busy assignment here,
Okay.
so we need to get moving.
Okay.
All right. Yeah.
Now let's watch how benchmarks provide a preceptor with a consistent roadmap to collaborate and plan and evaluate a transition nurse.
Anna, how are you?
Oh, I'm great.
Good. This is Maria. She is coming here today. She was going to be orienting with Renee, but Renee called off sick.
Okay.
Is there any way I could let her work with you today?
Oh, sure, yeah.
Okay, great. Thanks.
Yeah.
I know you have a very heavy assignment, but I'm thinking together you can work on it.
Mhm.
And if you're running behind or there's a problem, please let me know.
Okay.
Thanks.
Thanks.
Okay.
Thanks, Lisa.
Bye.
Hi, Maria. I'm Joanna.
Maria, it's very nice to meet you.
Awesome to meet you too. So tell me, how much clinical experience have you been here on the unit?
Oh, this is going to be my third day.
Okay. And your third day. So who is your regular preceptor?
Regular preceptor was Renee. She was
Renee?
really nice.
Yeah. She was my preceptor when I started.
Oh, really?
Mhm,
Oh,
mhm.
cool.
All right. So, last time you and Renee worked together, did you all work on your goals for the next time?
Last week, we did the NDR benchmarks, and she signed
Okay.
me off on my shadowing experience. So this week, we were going to focus on documentation and assessing.
Ah, perfect. Okay, did you have a chance to review the criteria?
I did it last week.
Oh, awesome. Okay, well, let's take a few minutes.
Okay.
Let's review the criteria one more time.
Okay.
Okay, let's pull this up. Okay. All right, so, well, we do have a heavy load.
Okay.
So what do you think about performing all the assessments on all of my 5 patients?
Oh, perfect. Okay.
And then we'll practice your documentation on 2 of them.
2, okay.
Right. So, and then I'll be able to review it with you. But, this way we have a heavy load. We can still get the job done, but you'll be next to me and we'll work on everything together. That way you can still get your practice in.
Awesome. Okay, 2 of the 5. Got it.
Yeah. And this way you can see how I manage the entire assignment.
That's awesome. That's a good plan.
Maria, I want you to pay attention to how I delegate to the UAPs.
Okay.
And definitely how I prioritize. So this way then you can make this a focus when Renee comes back.
Okay, perfect. That sounds awesome. Thank you very much, Joya.
You ready to get started?
Yes.
Let's go.
These are the 11 benchmarks you will be validating with your transitioning nurse. They are clear and concise criteria that will help you know when to transition that nurse into independent practice. Validation of all 11 benchmarks in conjunction with your input, your manager's review of the progress of this transitioning nurse, really is what deems the nurse safe for independent practice. This individualizes each nurse's immersion period or the time spent working with a preceptor. Some transition nurses take 10 weeks to have their benchmarks validated. Others may only take 8, and another nurse may take 16 weeks. The point is that once all benchmarks are validated, that's the point that this transitioning nurse can go into productive staffing and be part of your team. So here is an example of the initial benchmark, shadowing, with the criteria for validation. All transitioning nurses should begin with at least 1 shift of shadowing their preceptor. The rest of the benchmarks do not need to be done in the order they are presented, and oftentimes you'll be working on multiple benchmarks at the same time. As a preceptor, when you offer your transitioning nurse the opportunity to shadow you, you are role modeling all 11 benchmarks without even thinking about it. You are assessing and documenting on your patients. You're administering and monitoring medications, actions, and teaching associated with that. You're constantly communicating within the healthcare team. You make clinical decisions based on your critical thinking skills, and you show how to prioritize the most important interventions to help your patients achieve the best outcome. So let's just take a look at the next benchmark on the list. Let's look at assessment and documentation. Do you see how concise the criteria is to validate? Does the transition nurse use 2 patient identifiers every time they're interacting with their patients? Do they do a complete and thorough, accurate assessment and document it properly in the electronic medical record? Do they document refocused assessments and update the plan of care? These criteria are simple but very specific. Successful preceptors really know what their role and responsibility is, not only within the organization in that role, but to that transitioning nurse. And successful preceptors actually access all their resources and use those to their advantage so that this can be a seamless transition for these folks. We really want to engage with these transitioning nurses and bring them onto our team, and we really want them to become a successful part of our team. It's really critical that preceptors follow this married state of preceptor model, even as difficult as it is to get used to it. We tend to fall back into our own old ways when we get very busy and when we have a high census. But in order to really ensure the safety and the competency practice of this transitioning nurse, if you can commit to the married state preceptor model for that just brief time that you are orienting that transitioning nurse, it'll make the world of difference in their performance and their competence once they are out of this transitioning or this immersion period of the precepted time. Successful preceptors also perform regular reviews of their progress, talk all the time to their transitioning nurse about what they're comfortable doing, what they're not comfortable doing, and really relays that communication of what your expectations are as a preceptor and what the expectations are within the organization to become a successful team member. It's also critical that you validate benchmarks and competencies that are assigned to your transitioning nurse in Engage. Do it electronically. We do tend to get caught up in paperwork and wanting to sign things and carry and print these documents. It's really critical to validate these within the electronic management system, this electronic medical record, because it gives real-time progress for everyone and a transparent way to view the progress of the transitioning nurse. So that's what will make you successful and also help transition these nurses to successful practice on your team and take care of your patients. In summary, consistent processes lead to consistent outcomes. So good luck and thank you for your time.